Hello again. I'm Dr. Nadim Geloo, Senior Medical Director for Abbott Structural Heart Division and a board-certified cardiologist. I'm back to answer more cardiovascular questions submitted by our Abbott HeartMates community. Let's have a heart-to-heart. Okay, let's check the HeartMates inbox. We have a question from Michael Bravery from New York, who is a member of the inaugural HeartMates team. And he asks, how does someone get a heart defect? Is there a certain process that could happen at birth or even in the womb? How does it form over time? That's a great question. The heart defects that one can get can be a variety of types. You can be born with a heart defect, which means that while the heart is developing in the womb, it doesn't develop completely, and then there's an area such as a hole in the heart or a valve doesn't completely form, and that can cause symptoms immediately at birth if they're severe enough, and sometimes these symptoms can manifest later. This is why it's really important for babies to get a heart check right away as soon as they're born, but also for children to follow up with their physician regularly so the heart can be checked. In kids, sometimes they may hear a murmur, and most of these are benign, but sometimes they do require further evaluation. And as adults, we can have things happen such as a heart attack, which is caused by a blockage in one of the arteries of the heart, and this can also cause a cardiac defect or damage to the heart. And you can also have other problems that are related to sort of wear and tear on the heart, where you get defects in the heart, such as valve disease, valve blockage, or a leaky heart valve. Let's go to our next question. And this question is from Ben from Illinois, and Ben asks, how should I know if chest pain is heart-related? That's a great question, and I think the answer will really help everybody. Pain from the heart is different than pain from other parts of the body. If someone were to touch you on the back of your hand, you could instantly tell them, hey, you're touching me on the back of my hand, and of course, if it's painful, you might get mad at them. But chest pain is different. Pain inside the chest is different because you can't tell where it's coming from. Pain from the esophagus, from the chest wall, from the lungs, all that can feel very similar. We have an expression in cardiology called time is muscle. Every minute that you lose from getting therapy can be more heart muscle lost. So anytime you have chest pain, please get this evaluated by your physician. And if it's serious enough and you're concerned enough, and if it's after hours, please call 911. It's never wrong to do that. This next question is from Amy from Oregon. Is shortness of breath a sign of a heart problem or a lung problem, or both? It can be from both. Shortness of breath can be caused from problems related to the heart or the lungs, or even other problems such as anemia or deconditioning. When it's from the heart, it can be from things such as a weak heart muscle or a blocked artery in the heart, or perhaps a heart valve that's not working. This can mean that the heart valve's leaking or it's not opening enough to allow the blood to flow through. Of course, we know about lung disease. Some folks have asthma or COPD, which can be a problem from smoking and other exposures. So it's important to connect with your physician to try to determine the cause of shortness of breath. Shortness of breath is not normal. So if you're having it, it needs to be looked into. Okay, we have time for one more question. This one is from Catherine from Texas, and she asks, are there any devices someone with a pacemaker shouldn't be around? Some things that an individual who's got a pacemaker should not be around for sure are things like arc welding equipment, if it's operating, a snowmobile, a chainsaw, large devices which would create something called electromagnetic interference. The typical household appliances are fine. Small household magnets are generally fine. You don't have to worry about those things. If you go to an airport, you should let the airport staff know that you have a pacemaker. They have protocols in place on how to manage that. Your doctor, once the pacemaker is in place, will give you a list of do's and don'ts, and these are pretty exhaustive and informative, so make sure that you have that copy on hand. And if you have any questions, most pacemaker companies have links that will connect you to their information for their particular product, which will also let you know which devices are safe for you to be around. Generally speaking, if you follow the instructions, it shouldn't impact your day-to-day ability to carry on your usual activities. I want to stress how important it is to connect with your physician anytime you have symptoms that are concerning. It's never wrong to do that, and it may save your life. And wow, these are such great questions you guys are asking. And we couldn't have this program without your questions. So please keep them coming, and please ask anything. That's what I'm here for. Thank you to all the HeartMates who wrote to us today. If you'd like more information about the Abbott HeartMates program and how to sign up, please visit abbott.com/heartmates. Thank you and goodbye.